Welcome to another episode of RCA in Focus. Today we'll talk through sleep disorder under the three domains of the RCA: data gathering, clinical management, and interpersonal skill. If you want to learn how to assess and manage sleep disorders, make sure you watch this video until the end. Thank you for stopping by this video. If you're new to this channel, hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead a happier and fulfilled life. I make new videos every Thursday on the subject of GP training, well-being, and high performance. Every Thursday I publish a new video. Make sure you subscribe to this channel so you don't miss any future videos. And don't forget to ring the bell so you're notified first each time I publish a new video. Let's jump right into it. Our case today is a telephone consultation. You see on your screen a request for callback. Mr. Smith, 55 years old, requested a telephone appointment to discuss his sleep trouble. How will you approach this consultation? Preparation is key in the RCA. You need to make sure that before you start the consultation, you have a glance at the patient record and you look at any relevant points that might have implication to the consultation. For example, you need to make sure that is this a new problem? Has a patient had problem in the past where they had sleep problems? Any mental health problem? Does a patient smoke or drink alcohol? What does a patient do? These are all things that you need to make sure that you check on the patient's record before you start the consultation. It might be useful to jot down a few key points on an A4 sheet of paper to help you in the consultation and guide you. Once you have a plan about how you're going to approach this consultation, you phone Mr. Smith. With telephone consultation, it's important that you make sure you have the right patient. So you need to check the patient's identifiable. At least 2 identifiables needs to be confirmed, and make sure that it is convenient for the patient to be consulted over the phone. Sometimes there might be other people around or there might be something going on, so the patient might not be able to consult with you. So before you start the consultation, make sure that you confirm that it is the right patient. Make sure that the logistic is suitable for the patient to be consulted, and consent the patient about the recording. If you're using 14Fish platform, the consent for the recording might already have been taken, but I would also encourage you to take your consent yourself, because in this way you are also making sure that you're building some rapport with your patient and you're making sure that the line is also good before you start your consultation. How will you start the consultation? What will you ask your patient? As always, it's important to start with an open question, so encourage the patient to tell their story. Could you tell me, when did your sleep trouble first start, Mr. Smith? Give patient time to tell their story and make sure that you're listening to your patient. Pick up on any cues that the patient might drop. Once the patient have told you their story, ask the patient specific questions. What do you want to know about this patient? We need to know more about the difficulty in sleeping. Is the patient having trouble to get to sleep, or is it a trouble to maintain sleep? Or is a patient waking up too early? We need to know whereabouts in the sleep cycle is a problem. Does a patient have any problem when they're waking up? Do they feel refreshed after a night of sleep? Non-restorative sleep results in impairment in daytime functioning or well-being. Ask about whether the patient naps during the day, because this will have implication to the sleep. Ask about the patient's general mood. If a patient is not sleeping well, then it will affect their mood. Daytime symptoms may include fatigue, decreased mood, or irritability. Some patients may suffer with malaise and cognitive impairment, poor concentration, and not being able to carry out their daily activities. Ask about the patient's sleep schedule. It's important to know at what time does the patient go to bed, what time do they wake up, how long are they sleeping, any awakening during the night. Has there been any change in the patient's environment, any change in sleep routine? Has there been any new noise, a bright light, or is a room temperature appropriate for sleep? Ask about any triggers. Has a patient been stressed lately? Ask about any caffeinated drink consumption. The pandemic has caused a lot of problem with sleep recently. Mr. Smith tells you that the pandemic has been causing more stress and it has affected his sleep a lot. Be sure to acknowledge what Mr. Smith tells you. Many people have not been sleeping well due to the pandemic. This normalization statement will help you to build rapport with Mr. Smith. Also about the patient's occupation. If the patient is a night shift worker, shift workers are known to have problems with sleep, and it's important to know about their sleep cycle. Also about whether the patient is jet lagged. Think laterally, consider alternative causes. Is the patient suffering with apnea? Is the patient snoring? Is there any problem with restless legs or sleepwalking? Let's assume Mr. Smith has suffered with depression in the past, and you've noted that from the past medical history. You might want to make sure that the depression is under control. Is the patient taking his medication regularly? We cannot underestimate the psychosocial implications of sleep disorders. Also about driving, also about work performance, also about the patient's relationship, also about their mood, sleeping, and social life. Explore the patient's health belief model. It's important to know about the patient's ideas, concern, and expectation. Is the patient worried about their sleep problem? What would the patient want out of the consultation? Let's say you ask the patient, what were you hoping we could do to help you today? And then the patient tells you that, I'd like some sleeping tablet, doctor. Then you know what the patient would expect from this consultation. There's no specific examination one might want to do in sleep disturbance, unless when you're taking your history, you find that there's something specific in this clinical situation. Time management is key in the RCA. Make sure that you transition your consultation from data gathering to clinical management at minute 6. If you have done a good job in data gathering, you need to have a list of your differential diagnoses. Differential includes narcolepsy, restless leg syndrome, or circadian rhythm disorders. Address any circumstances or stresses associated with the onset of insomnia. With the pandemic, many people have been stressed and have not been sleeping well. So if there's any sources of stress, see how you could address that. Sleep hygiene is a big one. Make sure that you educate patients on good sleeping hygiene. It's important that we increase the awareness of behavioral, environmental, and temporal factors that may be detrimental or beneficial to sleep. For example, educate the patient to avoid napping during the day because this will affect their sleep during the night. Avoid any caffeinated drinks in the evening. Make sure that you explain to the patient the need to have a good bedtime routine, to go to bed at the same time every night, and to wake up at the same time every day. Recommend the patient to exercise during the day, but avoid any heavy exercises during the evening, and to wind down before going to bed. Some patients might find that relaxation exercise help. Listening to a relaxing music or reading a book might help them to sleep. Stimulus control is an effective treatment for primary insomnia. It is aimed to train the brain to associate sleep and the bed. The approach strengthens the bed as a cue for sleep and weakens it as a cue for wakefulness. Patients are provided with instruction to only go to bed when they feel sleepy. The bedroom should only be used for sleeping, and patients are advised not to watch TV or eat in the bedroom. If they do not fall asleep within 15 to 20 minutes, they should leave the room and only return to the bedroom when they are feeling sleepy. Sleep restriction therapy is an effective treatment for insomnia that limits the time spent in bed. Patients suffering with insomnia spend a long time in bed, but that does not always equal time spent sleeping. The patient is asked to keep a sleep diary over a period of 2 weeks before implementing the sleep restriction therapy. Patients should identify the average amount of sleep each night. Time spent in bed is then restricted to the average estimated sleep time calculated by the patient. The efficiency of sleep is calculated by total sleep over time spent in bed. When the sleep efficiency exceeds 90%, the patient can then increase the time spent in bed by 20 minutes each night. However, if the sleep efficiency falls below 80%, the patient should then reduce the time spent in bed by 20 minutes each night. It is important to note that the time spent in bed should not be reduced below 5 hours. If sleep hygiene measures fail, daytime impairment is severe, causing significant distress. The next step would be to consider a short-term course of hypnotics to resolve the problem. consider a short course of 3 to 7 days of non-benzodiazepine hypnotic medication. There are many risks associated with hypnotics, such as falls, cognitive impairment, dependence, and withdrawal symptoms. We need to make sure that the patient understands that this is only a short-term measure, and this will help to reset the patient's sleep cycle. NICE-CKS recommend to prescribe the lowest dose that controls symptoms for the shortest period of time. Be careful when you consider hypnotic medication because you don't want to create a dependence problem down the line. From the history, you learn that Mr. Smith has been more stressed recently and on the edge, has been drinking 5 to 6 cups of tea every day. You also know that Mr. Smith would like some sleeping tablets. So what would you be advising Mr. Smith? When you discuss treatment plan with Mr. Smith, make sure that you involve him in the discussion and he also gets a saying in the decision making. So it's important that you discuss about sleep hygiene measures. A common mistake candidate makes in clinical management is they don't involve the patient in the discussion and don't have a shared decision. So it's important that you involve Mr. Smith in the clinical management. You explain about lifestyle modification, good sleeping hygiene, and you readdress the patient's expectation. Because as you remember, this patient wanted sleeping tablets. So you need to discuss about the pros and cons of sleeping tablet. Explain to the patient the risks associated with sleeping tablets and things that could be tried first before going down the medical management. So discuss with the patient and advise the patient about the pros and cons of each option and whether the patient would agree to try lifestyle modification in the first instance. And if this fails, then you may want to consider medical management. If the patient is suffering with stress and anxiety, you may want to consider relaxation exercises. You may want to print a leaflet about these relaxation exercises and advise the patient to do it regularly. That might help them before they go to sleep. Remember that clinical management needs to be done in partnership with the patient. If you don't actually involve the patient, then the adherence to the treatment plan will be low and likely to be unsuccessful. You may want to arrange a follow-up with the patient and also give safety net advice to the patient. If this does not improve, then to reconsult. If you have any questions, any suggestions, or any comments about how you would approach this case, please let me know down in the comment section. I look forward to reading your comments. If you found this video useful, I've got 2 videos I want you to watch. The first one is RCA case on tiredness. We discuss how to assess and manage a patient presenting with tiredness. The other video is on assessing headache. This is a common presentation that we encounter in general practice. Click on the right if you want to watch the video on tiredness, and click on the left if you want to watch the video on headache. As always, make sure that you subscribe if you're not already subscribed and turn on notification bell. Take care everybody. Bye bye.